Tom, you've been dealing with this now for almost 2 years. What advice would you have for other patients with respect to AML and the experience that they might have?
I would say to anybody who's been recently diagnosed or has been on it for a while or have been diagnosed for a while that there's a number of things you really have to do. As I mentioned earlier, I've been fortunate. I haven't had any illnesses because of my low counts. Two of the things I attribute that to, I carry a bottle of hand sanitizer with me all the time, and I probably use that 20 times a day. I wash my hands every time I go near a bathroom, let alone go in a bathroom. And it's just there's germs and bacteria out there, and you have to protect yourself as best you can. I wear a respiratory mask, which is more efficient than a paper mask that a lot of people do wear. If most people, the doctor and Dr. Steensman suggested this to me. We talked about stem cell transplant. I chose not to because of my age, and because I preferred to keep my my quality of life as it was, because I was doing well, and there's an awful lot of things that can happen to patients when they go through a stem cell transplant. Many people are very successful with it, and I'm glad that they are. I just didn't want to take that chance to go through that and have a situation where I was going to be affected by it and have my quality of life affected. And I just prefer to keep going the way I was.